What do we want?
Yeah. What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
What do we want?
Medicare for all!
What do we want?
Now! What do we want?
Medicare for all!
When do we want it?
Now!
That's right, brothers and sisters. My name is Joseph Givargis. I'm the director of Our Revolution. We are on a national Medicare for All emergency ambulance tour, and we are live in Timonium, Maryland, right outside of Baltimore. But brothers and sisters, this is no ordinary road trip. This is an emergency campaign to go after politicians who refuse to use their power to fight for the right to health care for the American people. The truth is, brothers and sisters, that Medicare for All is incredibly popular with our grassroots base. In fact, a new poll shows that 82% of Democrats support universal health care. 82%. But here's the problem. Even though a majority of Democratic voters want Medicare for All, only a minority of House Democrats, only a minority of our U.S. representatives are standing with us. Is that right or wrong?
That's not right.
That's wrong. Brothers and sisters, I want to put this in perspective. We control the United States House. We've elected 235 members to the Congress of the United States. We have a full majority, and Congress can pass Medicare for All right now. And that's why we're here. We're taking our tour directly to the districts of members of Congress who have yet to sign on to U.S. Representative Pramila Jayapal's Medicare for All legislation. Yesterday, we kicked off the tour by going to Steny Hoyer's district. We rallied with members of Our Revolution. We then went to Representative David Trone's office, and we demonstrated there. And Representative Trone agreed to meet with us. That is a victory. Give it up. Woo! So we're now at the office of Representative Dutch Ruppersberger, and I want to do a shout out to Congressman Ruppersberger. Unlike Steny Hoyer, he has agreed to meet with us. That's right. That's a victory. Congressman Ruppersberger saw that our ambulance was coming. He saw that Our Revolution, Maryland, was coming, and he has agreed to meet with the delegation. And what we want to do right now is share with you some of the stories that are going to be told to the Congress inside. We would take the camera, but unfortunately we can't do that. So we want to let you know how people here are telling their stories. Why is this important? Because this ambulance can come to your district. This ambulance can help put pressure on your member of Congress, and we need people to tell their stories. If you want to get involved, I want to ask you to text M4A. That's M4A to 83224 to get involved. Again, M4A to 83224 to get involved. Because brothers and sisters, this is a true emergency. Every day the Democrats fail to pass this legislation, 123 Americans die. Is that okay with you?
No!
Every day Democrats refuse to sign on to this legislation. 1,600 American families declare bankruptcy. Is that okay with you?
No!
No. And so what do we want?
Medicare for all!
And when do we want it?
Now!
What do we want?
Medicare for all!
When do we want it?
Now!
Right now, it's my honor to introduce Hal Ginsberg. Hal is the state organizer for Our Revolution Maryland, and he's been leading this charge. Give it up for Hal Ginsberg.
All right. Thank you so much, Joseph, for that lovely introduction. I really appreciate it. And it's been great touring Maryland, and we're actually on to the Garden State this evening for another rally in New Jersey. We do appreciate the Congressman meeting with us. This is a win, and we've had wins lately. We have won in Texas. Lloyd Doggett has signed on to the Jayapal Dingell legislation. John Yarmouth has signed on to the Jayapal Dingell legislation from Kentucky. So let's think about that. Texas has a congressman who just signed on. Kentucky has a congressman who just signed on. Two of the most conservative states in the country. We're in the third most liberal state. We've got to get our entire Democratic delegation on board. We're going to do it. Let's start right now with Dr. Laura Kaplan-Weissman.
Thank you. Hi, my name is Dr. Laura Kaplan-Weissman, and I'm a family physician from Rockville, Maryland. I have provided primary care to people of all ages and from all walks of life. I know from firsthand experience that the Affordable Care Act, the ACA, has improved healthcare access for many, but necessary treatments remain unaffordable for average Americans. Each year, I've watched while co-payments for both my patients and my family go up, while insurance and pharmaceutical companies continue to rake in the profits. Without hyperbole, I can say that I see patients who grow sicker every day from all kinds of medical conditions due to the rising cost of healthcare in the United States. For example, one of my patients is a 38-year-old teacher and new father with diabetes and high blood pressure. His conditions were uncontrolled for years because he couldn't afford his $50 co-payments to see me, $30 to $50 co-payments for each medication. Diabetics and hypertensives take a lot of medications, and buying supplies out of pocket to test his blood sugars because, guess what, these weren't covered either. How is this health insurance? I can't figure it out. Last summer, symptoms of uncontrolled diabetes and high blood pressure made it impossible for him to work, and he had to go on disability for months to regain his health, leaving his students without a teacher and his newborn with a father with limited ability to care for him. I have to leave this event early today because I'm going to a wake. My sister's getting married in November, and her fiance's father just passed away from pancreatic cancer. After a long struggle this entire year with pancreatic cancer, dealing with, is he going to live? Is he going to die? Neuropathy, his nerves burning in his hands and his feet, his whole body turning yellow, becoming swollen in his whole body, having such fatigue, can't get out of bed, depression. This man who's worked for his whole life, who got a second mortgage on his house to put his children through college, who has worked his entire life, the thing he's worried about most this year is not dying of pancreatic cancer, but going into medical bankruptcy and leaving his family with debt.
That's not right.
It's not right. He's, every time I think about it, it makes me just cry inside for a person. So many people in this country, I've watched them all who are working, and then they're sick and they're struggling with their illness, and then to only care about the finances and leaving your family with debt. We need to change this. It cannot be this way in this country.
That's right.
In addition, physician burnout continues to grow across the United States. Most doctors go into medicine to try to help people, but instead, the doctor-patient relationship is being eroded by hours spent each week negotiating prior authorizations, medication formulary changes, referrals, and ever-changing, narrow, tiny networks where there might be one doctor or no doctor within 50 miles of you, and payment for visits from an array of plans from many different insurance companies. It is financially difficult for many physicians to stay in business and take health insurance, especially small private practices and those in rural areas, which is contributing to a nationwide primary care physician shortage. Many doctors are retiring, leaving medicine, leaving rural areas, decreasing their hours, or merging with larger health systems to maintain financial solvency and their mental health. It does not need to be this way. It is important to remember that we did not arrive at our current healthcare payment system for moral, ethical, or inevitable economic reasons. Dozens of other countries already provide universal care at a far lower cost. The United States must follow suit. This is not a matter of choice. It is a matter of will. Do we have the will to treat healthcare as a right and not a privilege?
We do.
Can we do this?
We do. Yes.
The Medicare for All Act of 2019 can solve many of these problems of healthcare affordability and access. There are currently 110 co-sponsors of H.R. 1384 in the House and 14 co-sponsors of SB 1129 in the Senate. We applauded for Ruppersberger. Let's hear some real applause also for Jamie Raskin, Anthony Brown, John Sarbanes, and Elijah Cummings. Thank you, our co-sponsors in Maryland of H.R. 1384. However, Maryland's two senators, Ben Cardin and Chris Van Hollen, as well as Representative Steny Hoyer, Just Ruppersberger, hey, maybe that'll change today, David Trone, and Andy Harris are not among the co-sponsors. Yeah. I agree. As a medical doctor, my prescription for our nation is universal health care. This is why I was with Senator Bernie Sanders when he introduced the 2019 Medicare for All Act. And that's why I'm fighting for health care now. Thank you.
What do we want?
Medicare for all.
When do we want it?
Now.
What do we want?
Medicare for all.
When do we want it?
Now.
Healthcare for people, not for profit.
That's right.
right.
Woo!
Folks, we actually got another win. We have been invited inside, so we're going to take this show not on the road, but upstairs, and we'll be filming the rest of this video there while 5 of us and yours truly do meet with the Congress member. So, cut. All right, so
Say, you sure you want me to make this speech?
well, do whatever you think is right.
I've already written it out.
You can't get your phone. Coming from my phone is what's coming out.
My water bottle in my purse.
Yeah, we're here. Right? How can they say we're not? Bring your signs with you. Bring your signs with you.
I have to go. Should I go with somebody else?
Sure thing. Wait, is there a pole sticking out?
It's okay.
I need the pole to hold it. No, it's still going.
Bring the podium in.
Bring the podium. Shoot. Can you put this in the back of the car too?
Yeah, I'm gonna do it this.
I'll be able to hold it as soon as I get this pole on here. We're good.
Oh, it's fine, Hal.
We're going.
You're an actress.
We're going. We're going in. My car's not going to get towed now, is it?
Who's the owner of this vehicle?
I'm not the owner of the van. I've got the silver car.
As long as you're not parked illegally, you won't be towed.
Am I parked illegally there? Okay. Thank you.
So you're not random. Neither of us random.
How you doing?
My question is,
Thanks, sir. Yo, help me.
See you this house though. It's up to you. Yeah,
And we're gonna bring you guys up some water.
Thank you. Oh, he's already in here?
that was what I was gonna say. Is if we wanted to just set up like after.
So, hi, can I do a quick interview with you? Can I do a quick interview with you?
I don't have anything prepared.
It's okay. It'll just be
I'm really
like,
good at winging it.
you're just a
Is it okay
doctor.
if I let this go? Just don't listen.
So then later on,
Okay. should have statehood. He changed his mind just the other day about it, so maybe we can change his mind about Medicare for all too. So we're here again, waiting to see what the results of the meeting are with 5 Our Revolution Maryland activists, a couple who are physicians, and Congressman Ruppersberger. We're hoping he'll do the right thing and co-sponsor the Medicare for All Act of 2019 that was initially sponsored by Pramila Jayapal.
It absolutely can control costs and extend wonderful care. The improved Medicare bill has the potential of taking the United States from having a distinctly inferior medical system for people to one of the best in the world, if it's done.
Great. And how long have you been fighting for this issue for a while?
You don't want to know, 25, 30 years.
Wow. And I asked one of your colleagues this earlier, but have you seen a change in the way the concept of Medicare
Enormously attractive.
Right. And you know, you've seen lots of healthcare fights
Yes.
in 25 years or so. Would you give this fight any odds?
We're in an upswing.
Carolina. So let me go sit over there. I wonder if it's because my phone. Go inside. Sorry, let me figure this thing out. Go inside. Yeah.
And I was on that constitutional convention back in, God, whatever year that was, when we wrote state constitution.
Yeah. That was a long time ago. I think it was before I even moved here.
No, that goes back to the late 80s, I think.
Yeah. I mean, I didn't move here until 1999. So, almost 20 years ago.